Okay. Um, so welcome everyone. I'm Matt Bateman with Guidepost Montessori. If you don't already know, we are an international network of Montessori schools and Montessori parent services. In the US, we have schools in a number of states and a number of locations that are all in pretty different places with regard to the pandemic. I'm very, very pleased to have Dr. Amesh Adalja with us today. He is a senior scholar at Johns Hopkins University Center for Health and Security. He works on thinking about preparing, combating infectious diseases and pandemics. He's done this for a long time. He advises on national biosecurity. I know that he's advised on emergency management for the New York City health system and much, much more. So great to have him. Google him. Check out his many media appearances, citations on articles on infectious disease and the pandemic. He had a really nice one about a month ago on Medium, I believe, on the pandemic. Really, really happy to have him here. So thanks for joining us, Amesh.
Thanks for having me.
So we're here to talk about the pandemic in general, but also specifically how it affects children in schools. I want to understand more about what we know about how COVID-19 affects children, to what extent children are transmission vectors, and more. And also, this global health crisis has been a crisis in education and childcare. The vast majority of schools in the US, certainly, I think also elsewhere in the world, are either shut down or converted to virtual. So I'm going to start off with some questions. We already have some questions from participants that were emailed in the queue that I'll get to, and I'll also be looking at questions that you guys post in the chat as we go. So let's start off. So let's just start with the basics. So since the beginning, when Wuhan and other areas in China shut down in January, it's really seemed like even then, kind of from the start, this virus spares children, or if not spares them, doesn't affect them nearly as much. So is that right? Like, how susceptible are children to the coronavirus?
So there's two different questions there. So are children susceptible to infection? The answer is yes. We do find that children can get infected with this virus. It's that they're spared from having the severe disease, and they're grossly underestimated in the rates of in those that are hospitalized or those that have severe infection. They are not, you don't usually find them. This is something that has been a bit of a mystery, and we're trying to understand why that's the case. And it may be that the immune system of a child just reacts very differently to this virus, and in general spares them from the worst consequences of it. And it's not that the case that it's not zero. It doesn't mean that it never happens. It just means that it's very unlikely to happen.
I see. So children get the virus, but it affects them much less. Is that the idea?
Right, that it doesn't seem to be that they get pneumonia, that doesn't seem to be that they get short of breath or require hospitalization. There are exceptions to that, and we're hearing, probably somebody's going to ask me about the inflammatory syndrome that we're hearing about in New York, but that's a separate issue that's occurring. But in general, it remains true that children are not really impacted very negatively by the virus.
And I mean, you said that this is something that we're trying to understand. I mean, how far along are we in our understanding of how and why it affects children? Are there like running hypotheses as to kind of what's going on, or do you have views on this?
So there's a couple of things. So I think the biggest view is that the immune system of the child just doesn't react that robustly and cause this overreaction that's responsible for many of the severe symptoms that we see. The other part of that is maybe there's some cross immunity. Remember, this is the 7th human coronavirus that we've discovered, and 4 of those coronaviruses cause about 25% of our common colds. And children have much more common colds than the average adult does. So there may be some cross immunity that's helpful. These are all hypotheses. There is a big study going on right now funded by the NIH, I think it's called the HEROES study maybe, where they're actually going to look at all the children in detail to try and understand what their clinical course is in much better detail. But it still remains the fact that it's not something that we see much of an issue with children. But that's not, I think we can't be, yesterday Dr. Fauci used the word, we can't be cavalier, and I agree with that we still don't have enough data. And the fact that these inflammatory syndromes are arising in New York City means we still have to understand what all the cofactors are for a child having severe disease.
Yep, no, that's helpful. And so kind of, one question is, how does it affect children themselves? And another question that a lot of people are asking and that a lot of people are very interested in is, do children transmit the virus? Even if it doesn't affect them as much, are they likely to be vectors in the same way that everybody else seems to be.
So we know for other respiratory viruses, specifically influenza, that children can magnify influenza and really drive a community's outbreak. But we hadn't seen that before with coronaviruses. And right now, what we know is, yes, children get infected. Yes, they have a lot of virus in their nose. Yes, they have lots of contacts. But we haven't had documentation of children driving outbreaks or transmitting cases. There was an article in The Economist a couple of weeks ago, or maybe a week and a half ago, that actually talked about the fact that we haven't seen that yet. So it may be that, yes, children get infected and have the virus there, but they don't take that final step of being transmitters of the virus. And we don't quite understand why that's the case, because you would assume if they've got it in their nose that they should be doing it, but it's clearly not showing up in any of the studies that we've seen. So this is another super active area of research where they're trying to use this determination to understand what the role of schools will be because of the fact that their schools have been closed.
Yeah, and we'll talk about schools in a minute. I mean, this is one of the questions that's of most interest to us, is kind of what does this mean for schools? But this is, I mean, it sounds like the state of the research is the kind of state of what we know is, look, we're looking at it. We don't know. We don't kind of fully understand it yet, but it seems like from what we're seeing that children are kind of not transmission vectors in the same way, even though they do have, even when they have viral load. Is that right?
Exactly. But if you read a headline in a newspaper, it will not actually say, it'll say that in the text somewhere, but it will actually, the headline will be children appear to have the characteristics of transmission because they have the viral load and they have the contact. So most of the studies that you're seeing are making a jump from those two to transmission, which isn't quite warranted. And the epidemiology data doesn't actually support that yet. So I think that there's a little bit of sloppy reporting going on, and maybe that's too nuanced for a non-health reporter to understand, or a non-science reporter to understand. But
Yeah,
that's what you're seeing, because definitely the New York Times has written articles to that effect. It's all the details I'm saying are buried in the article, but the headline is misleading.
no, I've seen that too. I mean, there was one a few days ago in particular that cited something like you're suggesting, and also a kind of modeling study that was like, look, like, you know, kind of this is what we would expect to see, kind of given other patterns, and we would expect children to be transmission vectors. I mean, I don't know if you have views on this, but like, why is that? And I mean, in general, how do you think of, like, it seems like part of the issue is that there's uncertainty. There's things that we don't know about how COVID affects children. But everybody that has children, it's like a very high priority issue. They have to take action. They have to make decisions about, you know, should I go to school? How are they going to impact my family? Like, how do you think about those issues?
I try to stick strongly to the data and what we do know, what we don't know, and I tend to be probably a little bit more likely to say to not jump to a conclusion unless there's actual data that's supporting it, because I've seen things go wrong with outbreak responses when people make those types of assertions. So I think right now we're not the conglomeration of bad cases, or they're all in adults, people with other medical problems. We have not seen that many children that are sick. So I think that's something that I think we can rely on in general, that children do well with this. We haven't seen cases that are driven by children. There's been lots of epidemiological series looking at super spreading events, things like that. And we haven't seen children play a major part of that. Not every country closed their schools, and we don't hear about that turning into a major problem in any of those countries that didn't close schools. Schools are now open in parts of Montana and Idaho, private schools. And we haven't heard anything really. There's not enough time yet, but I think within 2 weeks or so, we'll have some idea of what that meant for that area. I tend to be of the opinion that children are not a major epidemiological driver of this infection, and that they are not going to be people that are severely infected with it, and that the children that are having this inflammatory syndrome, there likely is going to be a cofactor, because we did not hear about this beforehand. We're only hearing about it now. So that's really not suspicious to me, but that tells me that there's something else going on, that there may be some other thing we didn't control for, because this type of syndrome, something called Kawasaki syndrome, is something that's much more common in Asia in general than in the United States. And we didn't hear any reports at all from Asia. So I think this really needs to be a really deep investigation, trying to understand why those children reacted to the virus the way they did. And we haven't actually established that yet, because because this is definitely, it's a temporal association. We haven't found a causal link between them yet, but it is enough that would make me worry about it, and to alert doctors to think about that, and alert parents to keep an eye on it. But I don't think that that's the normal case of what a child is like when they get this coronavirus.
Yeah, so let's talk about this kind of inflammatory syndrome, or Kawasaki-like syndrome. Mark Williams asked in the chat, why am I hearing more about Kawasaki disease? I would say kind of, what is it, first of all?
Sure. So Kawasaki syndrome is a poorly understood autoimmune type of syndrome. So it's an autoimmune type of condition. So what that means is that your body's immune system reacts to something and causes inflammation all over your body. Kawasaki is known to cause things like red eyes, rash, abdominal pain, fever. And one of the things it does affect is the blood vessels. It attacks the blood vessels. And some people with Kawasaki syndrome, children, will get their coronary arteries impacted by this, meaning the coronary arteries get inflamed, and the coronary arteries are the ones that perfuse the heart or give the blood to the heart. So those are the ones that when people have a heart attack, it's the coronary artery that's been occluded. So that's what the concern is. Most children who get Kawasaki syndrome do really well. Some of them need to be put on aspirin for a period of time just because of the damage to the blood vessels of the heart. And most of us have suspected that Kawasaki syndrome has always been incited by some infection, but it's never been shown what infection has done it. There's always this story of maybe there was something that happened a week before, and then they got this syndrome, but nobody's been able to definitively link any infectious organism to it. But it's something that happens in clusters, and a lot of us thought that viral infections could do it, and that may be what's happening, is that the immune system in certain children reacts in a way that puts them into this Kawasaki syndrome type illness. And there have been most of them have done okay. They've been hospitalized and been sick, but they have survived. There are some that have died though. And I think the big question is do all these cases actually have evidence of coronavirus infection? What's the temporal association? Did it happen at the same time they were sick, or did it happen a couple of weeks later? What's special about these children? Is there something different about their immune system? Is there some way that some other cofactor that they might have had? All of that needs to be answered before we can actually say anything definitive, because this is even, the fact is we're in an where we don't know that much about COVID-19. We don't know that much about Kawasaki syndrome in general, and now these two together, we really know nothing about. So I think it's just something to watch, but remember that it's a rare occurrence and not the normal course for a child. If you do have a child and they have an unremitting fever, they have abdominal pain, if they have a rash, those types of things you need to think about looking for, having them be evaluated by a medical professional. But right now, I don't think this is anything to panic about, but it's something to think about and keep an eye on. And I think of it similar as to if you remember a couple of years ago or a year ago, the acute flaccid myelitis, where those children were getting paralyzed. It's that same type of thing, a pretty rare occurrence, but mysterious, and we still haven't figured that one out yet. But it wasn't something that we changed behavior over.
I see. So it's rare. It's serious, but treatable, but quite serious. So it's something to kind of be on the lookout for when there are symptoms. And it's not the normal kind of course for the coronavirus. And it sounds, from what you're saying, you have a bunch of questions about it seems like possibly related to the coronavirus, but in an unclear way. Is that?
Yeah, I wouldn't be surprised that we find a link. I just think that right now nothing is definitive. So most of us, all of us, including myself, are kind of speculating and hypothesizing based on what we know about things. But it's hard to know exactly what the etiology is or what the causal link is between the two. And I think maybe we'll finally unravel Kawasaki syndrome, because this is going to put enormous amount of resources onto the problem now because of the heightened attention with the coronavirus pandemic. But
that's interesting. That would be a boon. In general, even more broadly than children, it seems like every other day or once a week I read something in the media about there's some new way that the coronavirus causes damage that we didn't expect or understand before, in terms of the brain or the liver or the heart or something like that. Is that the case? Is it that this disease has a kind of unusually complex etiology? Is it just that we don't understand it yet, or what?
It's a little bit of a combination of both. We are finding that this virus does a lot of things that we hadn't seen with other coronaviruses, at least in big enough numbers to notice. like the younger people getting strokes, or the clotting that happens, or the intricacies of managing someone on a mechanical ventilator, how they kind of flip between two different versions of the disease while they're in the hospital. All of that is, I think, a function of the fact that we've never had this many virus infections at once that were that severe in the hospital with those many eyes on them. So we are seeing these rare things and learning to describe them a lot better. But it is the case that this virus does have, so when you think about how related it is to other coronaviruses, it's mostly closely related to SARS. And there were only 8,000 cases of SARS. So you can't really get a good picture of what's going on when you have 8,000 cases. And when you have 8 million cases, or however many we have now, that you're going to see things that are rare and we didn't see with SARS. And remember, SARS was killing at 10%. So these are like fulminant infections. So you're not even going to pick out these little intricacies because those people were so sick. These people, the case fatality rate may be around 0.5% or maybe 1% in certain countries. It's been, you're going to see things that are odd because you're taking care of these patients for a longer period of time, and there's so many more of them, and there's so many eyes tuned onto this in research papers being written that I think that you probably would have seen a lot of these same things with SARS if there were more cases.
That's really interesting. I mean, it's interesting how the scope of this and the interest, the justified interest in this is kind of driving knowledge in a certain way, and kind of makes it hard to make other comparisons where it's just like, well, when was the last time we had a global pandemic with a lot of survivors, and like, what should we expect,
So exactly, like think about Ebola. Remember, like the biggest Ebola outbreak before the West African one was like 400 patients. And nobody thought like, oh, these Ebola patients can get stuff it gets in their semen, it gets in their eyeballs, it can change people's eye color, it can cause all of these other problems we never saw until we had 28,000 people infected. So obviously that, this is just a general principle that the bigger your sample size is, the more likely you are to be able to come up with things. And we learned so much about Ebola just by having that many people infected, though, that their magnesium levels are lower, their potassium levels do this. Nobody had even studied any of that stuff before. So that's also part of it, is the fact that there's so many patients and that's all people are focusing on right now in most hospitals.
Yeah, really interesting. So a couple more questions about how it affects children, and then we'll turn to schools. So there's a bunch of people asked, what are the risks? Are there prenatal risks? Are there risks for pregnant women? We had a parent named Camilla who wrote in, I am pregnant and due in 5 weeks. I'm very afraid of sending my son to school. Other than the risks to my toddler, I would like to hear more about the risks to me and my newborn if possible.
There hasn't been much data on pregnant women having a more severe course. We do know in general that as pregnancy progresses and you're in your third trimester, physiologically you have less reserve because the uterus is pushing on your lungs and you breathe and you can't breathe as well. So you have a lower threshold to become short of breath. But there doesn't seem to be anything specific to the coronavirus with pregnant women. There's been one case report that the media has picked up on where the virus infected a placenta and caused placental insufficiency in a second trimester person. That's one case. There wasn't transmission there was actually a miscarriage, but the fetus was negative for the virus, meaning it didn't traverse the placenta, but it infected the placenta and made it insufficient. But this doesn't seem to be hitting pregnant women. So, for example, when we think about influenza really, really hits pregnant women hard. This doesn't seem to be doing that with pregnant women.
Interesting. And prenatally, would you say something similar, that there's kind of not evidence of risk to infants that haven't been born?
Yeah, I don't think that there's a major pregnant women and the fetus do not seem to be particularly at risk for severe complications with this virus.
Interesting. I mean, my first daughter came a couple of months ago, right at the, right as this was kind of becoming an issue in the US. And I have some friends who are delivering soon, one who has a scheduled C-section. And hospitals are on high alert about this in maternity wards. Like who can visit has been changed. And, the protocols have been changed even in late February. The kind of visiting hours were restricted. And do you think that all of that makes sense in the context of a maternity ward? Or
I think it makes sense in general for hospitals. We do this even during severe flu seasons, that we restrict the number of visitors. We say children can't come because children can magnify flu. So this is something that we do all the time. I think this is going to last for a little bit longer because no one wants to have a spread in their hospital because it can be very difficult if you've got staff members exposed, immunosuppressed patients exposed. So I do think that having visitation restrictions, at least for the near term, makes sense. And I think hospitals will probably continue it for some time. Actually, some of my nurse friends are actually liking the fact that there aren't visitors there because you don't have to deal with the nagging families. So that has been that makes it easier and to be more efficient there. But I do think that we'll see restrictions eventually lift, but I think for the near term, at least probably maybe even until we have a vaccine, hospitals will be really limiting visitor restrictions, and I think it all makes sense.
Yeah, yeah, okay, that makes sense. I mean, it's part of what's hard to think about is like, it might perfectly well make sense for a hospital to have a much stricter protocol, even though there aren't that escalated risks for pregnant women and for kind of infants, and like all of that can kind of come together.
But it's the same protocol they have to go visit a psychiatric
Right.
patient or to visit anybody. It's just right now it says general visitation policy issue. They're actually laxer in a maternity ward because they allow one visitor. Most patients don't even get one visitor.
Right. So one more question about children, at least from me. There might be others from the chat. Are there differences? So I mean, we have students from like 3 months old to 18 years old. Are there differences across that span in terms of how COVID affects things? Is it all low risk? Is it, is it like low risk but slightly less low risk? I mean, how do you think about that?
It's basically all low risk until you start to get above 18 and into the 30s, 40s. They're and even 30s and 40-year-olds are not very, very ill. I've not taken care of any sick person that's been in their 30s. And the only one that I took care of that was really sick was in the late 40s with diabetes. So it's definitely something that is clustered for the most part in people that are above 60 that have other medical problems. And I do think in general, people less than 40 probably do really well on average, barring any other medical conditions they have. Not that there isn't going to be case report. There's going to be exceptions to that rule, but it's kind of a general pattern that we're seeing.
Yep. Great. So let's talk about schools a little bit. So you said that and there's a couple of states where private schools are open. There are some countries that haven't closed down schools, and we haven't. It sounds like from what you said, we haven't seen there being major transmission or spreading events. It hasn't kind of made a dent there. But it also sounded like it was early. Like, it's kind of like we don't necessarily know yet. Is that? I mean, how do you think about kind of what we know about schools, given different countries, different states?
So I think we can take data from different countries and show that they really didn't run into problems, the ones that didn't close schools. And there are already schools opening back up in some other countries. So I think that we're going to have to watch those. But I am somebody that's on. So when schools closed, this was a very controversial topic. And it's been a very controversial topic in infectious disease for a long time, because most of the data comes from influenza, which is different. And the data from influenza isn't even that great. So it's kind of marginal to begin with, and most people don't think it's something that they want to do because there's all these negative consequences of that. Meaning, some children that, especially for inner city children that come from low socioeconomic groups, that's the only way they're going to get food. They're getting their breakfast and their lunch there. So how are you going to feed those children? How are you going to arrange childcare for those parents? Many of those parents who might be essential workers that you need to be out there working in the hospital. How are you going to deal with that problem? Then there's all of the obviously psychosocial aspects of schooling and intellectual development, and the fact that this homeschooling type internet type stuff is not something that every school district can do very well, or every school can do. Especially so I'm sitting here in Pittsburgh, and the city of Pittsburgh schools, not every child has high-speed internet, not every child has an iPad. And they actually had to distribute iPads to the students, and then they exposed some of the students that came to pick up their iPads because one of the distributors had coronavirus. So there's lots of stuff like that's been negative. So most of us were not, I guess not most, I would say probably half of the people in public health might have not been so enthusiastic about closing the public schools. And one of my colleagues wrote an op-ed in the New York Times at that point about it. And I think that's the case, is that it isn't something that's ironclad. And now we're seeing studies that show that the benefit is probably very marginal, especially when you take away all the other social distancing that on top of all the other social distancing you do, what does that add? Probably not very much. And like I said, there's not really strong data from even influenza where the case is the best. In coronavirus, clearly we haven't seen any of this child magnification like we do in influenza. So most people think that school should be one of the first things that open back up. Obviously, you're going to have teachers and other people that work at your school that are going to be in high-risk groups, and you have to be flexible with them and think about how you might protect if you've got like a 65-year-old teacher with diabetes that they may have to modify their work schedule or maybe teach from home or do something like that. You're going to have to think about making even though we haven't seen transmission, I think so part of the price of doing schools are going to have to be modifying the way you do things in terms of allowing social distancing, allowing more hand hygiene, that type of thing. And we're already seeing that in the schools in Montana and Idaho that have opened, that they're a lot different than what they were.
So you do think that, like, even if schools should reopen, that there will be health and kind of increased health and safety protocols, social distancing protocols. We should expect to see that.
Yeah, you should expect to see, for example, maybe some places might not have schools that the kids are riding the bus. Maybe recess will be different. Maybe cafeterias will be set up a little bit different. Maybe you won't change classes. Maybe the teachers will come to the different classrooms instead of the kids changing classes. There may be that kind of thing you're going to see happen. Lots more hand hygiene stations. Maybe desks are going to be separated. Maybe some municipalities are going to require the students to wear masks at certain times. Maybe there'll be testing protocols put into place at schools. I can see that happening. It's already happening in university level. People are talking about that type of thing. So I think that's kind of the price that we're going to have to pay to get schools open. But I do think that the general consensus is that schools should open, even amongst people who have been aggressive on social distancing, that this is something that you have to do quickly because the data isn't really necessarily supporting it. This whole inflammatory syndrome is throwing a wrench into this. And I think that's mostly because of the way the press has been reporting it rather than what people in the field are actually thinking about it.
Yeah, I mean, my sense has been also, that's been my sense, that the consensus is kind of gradually shifting in the US on this issue, but that there's also still a wait and see approach. Like, I mean, do you think that like in a month, from the countries that didn't close their schools or that reopened, or the states, like, we'll know more, we'll have more research, there'll be more clarity?
Yeah, I definitely think that's the case. And many states now have task forces going forward. And it may not necessarily, it may be that the state will say, okay, we can have schools open here, but we're going to leave this to the individual superintendent for each school district and the school board. And I think that's what's happened in Idaho and Montana. It's not, these are private schools, but the regular school district said it's at the discretion of the private school if they want to do it. So I think that may be what happens. It's going to be done school district by school district based on the resources. And some school districts might not be able to open, or they may be too scared to open, whereas others will not be. And I think it's all going to be influenced by a lot of legal reasoning and what the school board is like and what the parent PTO is like in different places. I think private schools are probably going to get a green light to open wherever they are, unless they're in the middle of a hot zone where there's major opposition to opening it. But I think for the most part, you're probably going to see private schools have much more latitude than a public school.
Yeah, really interesting. I mean, like, in certain ways, I think it's often the case that private school networks are waiting to see what the public schools do because they kind of feel like they're going to defer to the judgment. But I think you might see some exceptions to that in this case.
Yeah, it's interesting because I think that sorry, I just lost my train.
No, go ahead.
Oh, so one of the things is, I think it's become very clear to the public that this school closure is really exacerbating economic issues that exist already. That an inner city student who doesn't have high-speed internet, that doesn't have an iPad, can't distance learn the way someone can that has all of those types of resources. Like, I've seen some of my friends trying to help their fifth grader upload things that they've never had to do before, to learn how to upload this and troubleshoot Microsoft Teams and all of that stuff. I actually had to do that yesterday, troubleshoot Microsoft Teams for a fifth grader, because this isn't something that people have been expected to use before. And I think if you see all these private schools being given a green light, that's going to push the public schools and say, well, how are all these private schools opening? That's going to just make things, that's all these issues that they're already attuned to, that's going to actually push the public schools. Because I think it's very clear that this outbreak, it's a luxury to be able to social distance. Yeah.
I mean, I think that is one thing that we've seen as well. Another thing that we've seen, especially since so many of our schools are early childhood. And so there's like a whole largely private early childhood childcare sector where the same questions are coming up, but like kind of in a modified form. It's like, virtual learning is probably going to be very, very limited if you're younger than 5 years old. What the parents have to worry about, even well-to-do parents have to worry about, okay, like, now I have to do childcare in my home, like I can't even work remotely, I've got things there. And then in terms of school reopenings, the issue is, what does it mean to have a kind of elevated health and safety protocols for a room full of toddlers? That are like, it's going to be hard to get them to wear a mask, and they're going to want to be close to one another. Are there special kind of concerns there?
Yeah, I think it's going to be impossible if you've got a bunch of 2-year-olds and you try to put masks on them. They're going to eat the masks and things like it. And it's going to be even in New York State, there's a rule that if you're above 2 years of age, you have to wear a mask. But there's no way a 2-year-old can wear a mask, and they're likely going to contaminate more people with what they do to that mask. So I think that some of this has to be, there's going to have to be a risk perception change and a risk tolerance allowable for this. And it's going to be difficult, and it's going to, but I do think that in general, the most consensus of the parents are that they want to have schools open again, and I think that will probably drive school boards that are
Yeah. I
that
mean,
are
we've seen variance in our parents. I think some of our parents, are pretty eager to get back into school, and some of them are like pretty concerned about the risks. And you have the whole range. And like one of the questions is like, so, I mean, right now, actually, the preschools that are reopening, private preschools, part of what we're seeing is, yeah, you can't make a 2-year-old wear a mask, but you can put fewer 2-year-olds in a room. So they're changing the ratio requirements. Do you think that that's something that can help?
Definitely, I think it will help. I definitely think that that's going to happen. The class size issues that people have been whining about for a long time are going to this is going to actually push them forward, and you're going to get smaller class sizes. That's going to be one way to allow the 6 feet apart and allow a little bit more distancing and make it easier to clean those places and to have separate spaces for people to play. But I think I do think that this is going to be challenging because people want to have recess. People, I sit on the NCAA's coronavirus task force, and we're trying to figure out college sports. That's even harder than what we're talking about here, to try to figure out how to do that. So I think that there's going to be changes as we go through and how people deal with this risk, and as we get better at dealing with the disease and understanding it.
Yeah, I mean, like I think it'll be a big question as to in early childhood as to how effective it is to have higher ratios and smaller class sizes, since what is that? I mean, basically that's going to drive the cost up. Like it's going to make it prohibitive for some schools to even reopen. Kind of like if it's like, okay, like I can have fewer children with the same number of teachers or in the kind of same space, it's going to kind of really make things difficult economically. I don't know if you have kind of thoughts on how that's going to progress or views on that, or if that's just like, look, this is part of what we have to think about.
Yeah, I think it's going to be that way. And if you're a public school district, you've got a massive loss in revenue, because some of that revenue is not all from school property taxes. Some of it comes from what the state gives you, and state income taxes are not being collected right now. So this is going to hit public schools very hard with budget crunches that's going to make it even harder to decrease their class sizes and hire more teachers and it's going to be a real societal problem that we have to deal with now moving forward. And I think the public schools are probably going to get hit much, much, much harder than the private schools.
We have some questions, one from Chris, one from Deborah, about, so there's kind of a normal thing that happens when a child gets sick. It's like, okay, like you stay home from school until you don't have a fever for 24 hours, or, and then there's this pandemic protocols where it's like, look, you get a fever, like you're quarantining yourself for 14 days. And, like there's a kind of like, how do you think about that at kind of as a school policy? Are we kind of going to have the elevated, like more extended, or should we have the kind of more extended, like if you're sick, you should really, really be cautious and be out for a while, or is it not as much of a risk with children, or what?
I do think that we're going to have a modification for coronavirus testing, and I think this might get us better. I think the people are a little bit lax with influenza in these schools, and they could be a little bit tighter around their policies. But I do think it will probably be something like 7 days at least, with 3 days without fever, something like that. So that's basically what we're seeing with healthcare workers, and I think it'll be very similar to that. CDC is putting out guidance on this, which I think will be coming out soon. On how to think about opening schools. And I think it's going to be something like that for cases. It's going to be difficult, and you're going to have disruptions based on it. And maybe some of it will be a little bit overkill, but I think that's going to be almost the standard that you're going to have to deal with it. And it won't be, and those children, I think you probably would set up alternative learning for those people, have them Zoom in or whatever to class, because they may not be, they're going to be mild cases. And the other thing is that the CDC is still not recommending testing asymptomatic individuals. So many of those children are not even going to be, I think it's going to be a point that there's going to be kids in your school that have it and that are asymptomatic, and it's unclear how well they spread it, especially asymptomatic individuals. But it's only going to be the symptomatic individuals that that you have this kind of protocol for. But then what will happen is your health department will come in and do a contact trace and then probably test all of the other kids, and then you'll find more of them, and then you'll be stuck with it.
Yeah, I mean, I guess some of this depends on like looking out 3 months, so especially to the fall. Like that's the kind of like big deadline, for schools is what does the testing situation look like? What kind of infrastructure do we have in terms of contact tracing, and how does that affect schools? Like if it like, do you think it'll be like worlds better and like, look, like everybody gets tested periodically and there's contact tracing and that helps? Or are we still looking at, things will be changing. There will be quite a bit of chaos with regards to testing. I know it's hard to know, but
I think it's going to vary based on state to state. It's in municipality to municipality, because health departments have varying degrees of resources. Everybody's trying to scale up a lot right now, but I still think it will be a patchwork. I don't think it'll be worlds better. I think we're getting better, but I think we'll still hear about problems that are happening, but it may not be testing anymore. And I think it's unclear what interval we want. If we want to actually test everybody, then retest them every 3 weeks or 4 weeks. And I don't know how much of that is actually cost effective or makes sense to do. There will be places that will do that. I think some universities are talking about doing that, and definitely sports teams are talking about doing that. I don't know that you need to do that at every Montessori or other type of school. The contact tracing to me is going to be important to make sure that we have that in place, because that's going to keep the cases, that's going to make people feel secure that the cases that we are getting are under control and not being allowed to turn into chains of transmissions that spill into hospitals and put them into problems.
Interesting. So if I was going to kind of zoom out and summarize my understanding of a lot of what you're saying, it's, look, there's going to be elevated health and safety protocols at schools. For older children, that means increased social distancing, that means masks. For younger children, that might mean reduced ratios. It might mean kind of, elevated kind of standards as to like, if you get sick, what happens, kind of protocols around tracing when that happens. But it doesn't necessarily mean that school won't happen, or that if somebody gets sick, the entire school will shut down, or it sounds like this is something that we're going to have to learn to manage come the fall. That's your view.
Right, because otherwise you're going to be, the virus isn't going anywhere. You're going to get cases at your school. So that people have to get comfortable with trying to operate in the midst of this virus without shutting the school down every other day from the new case. Otherwise, it's just not going to be functional to even have a school. So I think that there has to be a protocol in place where that unless your entire class is sick and there's no one to have school for, then you kind of try to go through it. And I think it's just going to be different. It's really going to be how your parents and how the parents handle this is really what's going to drive it. Because I think what we saw in Idaho and Montana is the parents all voted to have the school open. They left it to them and they said, we want it open.
I think that's going to vary, but, and probably be shifting quite a bit over the next few months. Deborah asked a related question. If one child tests positive in the class, would contact tracing mean that the entire class and teacher need to be quarantined? If so, for how long? It sounds like you're saying no, but can you comment on that?
So it depends on what the exposure is. So if it's a significant exposure, so more than 10 to 30 minutes within 10 feet, then I think it's considered a significant exposure. So we do this a little bit different. So we have, in a healthcare setting, what we would do to that person is say, okay, you were exposed, you can come to work, but you have to wear a mask and tell us if you get sick. I don't know that you're going to be able to do that if it's a 4-year-old. So I do think that there's going to have to be, the contact trace will figure out who had significant exposure, and then they may test them at enough of an interval for the incubation period, and then make a decision. So I don't think it will be, I don't think it will be the whole teacher in class being quarantined, although it may vary because the policies are going to vary from each school. I think strictly scientifically speaking, probably not. I think you can get away with being aggressive with contact tracing and monitoring and doing testing when necessary and avoid this type of these types of quarantines. But again, this is all shifting, and someone's going to come up with a policy that's acceptable to everybody so that we can move forward. And it may be more than what actually the science would say.
Interesting. So one set of questions is like that we've been kind of talking around is like, how do you think about this if you're a parent? What are the risks? When do I send my child to school? What should I expect to see at schools? Another set of questions is like, how do I think about this if I'm a teacher? Am I at increased risk? Kind of going to work, teaching a bunch of kids, especially young children. Are there kind of, should I be wearing a mask and wearing gloves and washing my hands all the time? Should I even be going into work? how do you think about this?
It all depends on who the teacher is. And if the teacher is in one of those vulnerable groups, an older person with other medical conditions, you really have to be careful, not just with going to work and teach, but everything you do, because the virus is going to still be a threat to you until there's a vaccine. So that's something that you're going to have to think about. And there's certain things you can do to modify your life. And I think it's going to be an individual decision for the teacher. Do they want to put themselves at risk? And many teachers will probably say yes, and some teachers are going to say no. What you can do is try to social distance as much as you can. You can try and wash your hands as best as possible, but you're going to have instances in a school where you're going to have to interact with children, especially if they're like elementary kids and they're crying or they scrape their knee and you have to deal with it. You're going to be in contact with them. So I think it's not going to be like an overly prescriptive answer that I can give, and it's not black or white here. So I think it has to be what the teacher's own comfort level is, how they want to do it, and it's also probably going to be the school saying, you're too much of a risk to us if you get sick here, so we're going to make you distance teach to the class, or put you in put plexiglass in something like that. If the teacher's so great. But I don't know how they're going to modify it, because then you run into this whole age discrimination thing that may end up happening as well. So there's a lot of questions from a legal perspective that I think have to be answered about how we translate individual risk into what our policies are going to be.
Yeah, I mean, I know what, I mean, it seems to me like what's really one of the big patterns that's really emerged over the last few months is that there are massive differences in risk, kind of depending on your demographics and your risks and who you are and your age. And part of what's difficult to think about is like, okay, like what does that mean in terms of a policy? Like, is there going to be like a big prescriptive policy, like stay at home until we have this, some sort of general testing regimen, or is it going to be loosening up in a kind of more complicated way where there's a bunch of individual decisions and people are trying to learn about how it affects them? And it sounds like you're kind of more in favor of the latter. Is that right?
Yeah, I think I'm in favor of that, and I think that's actually what's going to happen, because there hasn't been like strong federal guidance. So this is each state kind of doing its own thing, and even within the states, each county doing its own thing. So that's what we're going to basically have. And I think that the individual, even if the individual wants a more paternalistic type of solution, is going to be faced with the fact that they're going to have to make these decisions themselves, because they're going to be different depending upon where you live. And it's going to get back to what you would expect, even if it was completely up to the individual, because of the way the government has kind of handled this whole thing.
So if I'm a parent or a teacher and I'm thinking about this, and there's all these kind of local considerations, like what kinds of so I'm in New York, we've got families in like Georgia, which is opening up, in Texas. We have families in California, we have families in other countries. Like, what do you look for locally to kind of think about, like, where is, is it hospitalization rates? Is it case rates? Where is my locality in terms of coping with this pandemic?
So it's different for different people in what you're thinking about. So what I look at how are the hospitals in crisis? Because I think that's where government intervention is necessary to make sure the hospitals don't collapse. So I keep looking at that to say, we're okay, meaning that I'm willing to accept that there are going to be cases, there are going to be deaths, but I know that they're hospital beds, that the hospitals are in okay situations, so we're not going to get excess deaths because the hospitals are in crisis. That's what I look at. But I think it's going to be different. If you're a vulnerable population, you're going to have to look at how many cases are out there. What's my likelihood if I go to the grocery store, I'm going to run into this virus? That's going to be a very different calculation someone that's in a high risk group makes than what a policymaker makes, deciding, do I need to shut down bars again? So I look at that. I also look at the percent positivity of tests, meaning the test numbers are the same. Is it going down? And it's definitely going down in certain parts of the country, and it's going up in certain parts of the country, or it's flat. That's a good. So if you're looking really hard to find cases, that's a good sign that your community has this under control. If the percent positive is going up, you can expect things are going to get bad. So if it's like going from 14%, now it's 16%. And if you're below if you're in single digits, you're in good shape.
Yep, that's helpful. So there's a few questions that I haven't gotten to. I think what I will do is probably ask Dr. Adalja some of these specific questions offline and then send out a note to all the webinar participants. I just wanted to close with a personal question, if you don't mind. Feel like I've been really fortunate to know you. We're really lucky to have you, and also the entire army of researchers and practitioners worldwide that's like done amazing things and sequenced the genome of this thing almost instantaneously, and thinking about how it spreads in real time and coping with uncertainty. Like, how did you get interested in all of this infectious disease stuff? Like, this is your life, but I mean, for the rest of us, it's new. And I'm curious kind of like like what fascinates you about it? How did you get into it?
So I've told this story to a bunch of people, but when I was, both my parents are doctors, and one of my favorite storybooks was the story of Louis Pasteur, The Value Tale.
Mm,
It's called The Value of Believing in Yourself, and it's about how he developed the rabies vaccine. And I got obsessed with that when I was a little kid, thinking about a virus, thinking about the immune system and how they fight like a war. And it was something that I always thought was really interesting. And then I guess I grew up in the 1980s and HIV was going on and the
mhm,
early days of that. I got fascinated by that. My mom is a pulmonary doctor, a lung doctor, and she was taking care of some of those first HIV patients. And I thought that was really cool too. This was all mystery. And then I just loved the detective work of it and I like the fact that infectious diseases, out of all the fields of medicine, nobody else would be giving a lecture to a Montessori group. It impacts everything. That I knew
yep,
that an infectious disease pandemic has cascading impacts where you have to know about politics, sociology, education, psychology. Every aspect of society gets impacted by an infectious disease. So you got to touch everything, and it's that part of it is really interesting to me because if you think about a heart attack, that doesn't mean that's one little thing that happens. An infectious disease magnifies because it affects everybody's life, and I think that part of it makes it really interesting and gives you a broad base that you kind of have to do everything. But it's really the detective work and figuring things out that I think is awesome about it. And I thought I always, when I was a little kid, I wanted to be a private investigator. I thought that would be really fun
that's
to
so
do,
cool.
to figure out stuff. So I think that's what it is like when I get a case of a mystery illness and I got to figure out what they did. Where were you? Who did you talk to? What are your hobbies? What kind of pets do you have? All that kind of stuff is really fun for me to try to piece it together and solve the puzzle. That's kind of what I like about infectious disease, that I have to make the diagnosis and go and sift through all kinds of stuff.
Well, thank you. Yeah, that's awesome. I mean, thank you so much for your work and your thinking. And it's part of an effort that hopefully will allow us to get past this and reopen schools and raise more children who are interested in cool things like infectious disease or whatever they're fascinated in, and perpetuate the cycle of human beings fighting off entropy in natural disasters and disease. So thank you so much for your time, Dr. Adalja. We really appreciate it.
Sure.
All right.
Bye.
Thanks, everyone. Bye.